Hello, I'm Stephan Schwartz, and it's my pleasure to welcome you to the Schwartz Report. This week, I want to talk about a strange and benighted trend that is negatively affecting half the population. We're having all this conversation about the post-Dobbs decision and abortion restriction, but I want to talk about something that is happening partly as a function of that, but also because it represents a point of view, a way of considering half the population that, in my opinion, just doesn't make any sense. What I'm speaking about here is that in Republican controlled states, politicians, not physicians, are making the medical decisions for females. According to a study published in the Journal of the American Medical Association, as of July 7th, 2022, that was the last time I could get absolutely reliable data, across the entire United States, there were only 17 federal physician legislators, 3.1%, and 86 state physician legislatures. That's 1.1%. So it's irrefutable that these laws that are being passed and we're seeing debated are being passed not on the basis of sound medical practice, but to control women. And what's even worse is that they're being passed by non-medically trained politicians who have no idea what they're talking about. You listen to these stories of women who have some kind of complication and go to the hospital and they can't get any treatment because the politicians have passed some kind of law. And so the doctors who know exactly what ought to be done aren't able to do it. Started on 24 June 2022 when the extreme far-right majority on the Supreme Court issued the Dobbs versus Jackson's Woman Health Organization decision that abandoned almost 50 years of precedent established by Roe v. Wade and took away the national right to abortion, leaving it up to the individual states as to whether they would permit legal abortion. Almost immediately, 14 states, Republican controlled, no physicians, and perhaps the most blatant example of the Great Schism trend that I have been talking about now for weeks, took the privilege of the Dobbs decision it conferred on the states and passed laws outlawing abortion. Now, there's been a lot of coverage about this in the media, but as I said, I haven't seen anything that makes what I think is a major critical decision. And that's what I want to address, because I haven't seen it discussed. And it seems very odd to me. To quote a paper published in The Lancet, one of the major medical journals in the English language, in May 2024, 2 years after the Dobbs decision, quote, "This shift has had an immediate health and equity repercussions. It is crucial to examine the broader impacts on states, healthcare systems, and on society as a whole. Restrictions on abortion access extend beyond immediate reproductive care concerns, and they necessitate a comprehensive understanding of the ruling's consequences across micro and macro levels. This control of women has morphed into a fetal personhood movement, a nationwide crusade to endow fertilized eggs, embryos, fetuses with constitutional rights. What makes this particularly bizarre is that the same states in which politicians are endowing fertilized eggs with the full rights of a living person also have the worst child care statistics in the country. So, oh yeah, we really care about these fertilized eggs. They have the full rights of a person. But now, once you're born, we don't really care. You're on your own. State laws, as you look at them, made by politicians with little or no understanding of medicine, protect fertilized eggs, but don't seem to care about children once they're born. The differential between how states that allow women to control their own body and those that do not are so different that as I looked at all this data, I found it very striking. Now, I've discussed this in various parts in earlier podcasts. However, I want to emphasize this week, this difference is very significant and large. The New York Times explored in each state and at great depth the correlation between what politicians who won't allow women to control their own body and the quality of their post-birth child care actually was. You can look at the chart. This is what they discovered. And this was 2 years ago in 2022. But I want you to look at the difference on this chart. The states where politicians have banned abortion have grossly inferior poverty rates, maternal mortality, infant mortality. So when you hear arguments, I heard a senator say, abortion isn't health care, and we care about children. When you actually look at the data and not the political partisanship, what you see very clearly is that they don't. Mortality numbers compared between the states that let women control their bodies and those that don't are very clear. And it makes the reality of the anti-abortion movement obviously a movement not to protect children, but to control women. And it also illustrates, and this is the point that you never hear anybody talk about, what happens when politicians, not physicians, address these issues. The social outcome data shows this is not about protecting the life and well-being of children or women. The data would not look like it does if that were the real purpose. But this is only part of the story. There's much more to these trends being created by non-medical politicians. So much, in fact, that I'd really have to devote a number of podcasts to this, but I'm going to focus on a few of the major issues so that you can get a sense of what I'm saying and that this is fact-based. I'll start with this. And this, this ought to be an embarrassment. The United States has the worst maternal mortality in the developed world. It's almost grotesquely so. And it is worse in states with laws limiting a woman's right to control her body. And it is also very racist. Why? Because the states that seek to control women are also the states that are the most racist. Look at this chart. Look at the US at the top of the chart. Look at the other countries. I mean, we're so bad that the death rates of women delivering children are at such a level that they almost equal the rest of these developed countries. 23.8 per 100,000 live births result in maternal mortality. If you lived in Germany, this would be 3.2. If you lived in Norway, it'd be 1.8. If you live in New Zealand, it'd be 1.7. So this country that says it's the leader and the greatest and all of that sort of stuff, in fact, has the worst maternal mortality rate in the developed world. I think that personally, as I said, ought to be a matter of national shame. And now look at this. Look at the racism. I'm not talking about partisanship and wokeness and all those other things that the right wing goes on and on about. I'm talking about facts. Black women face 3 times the maternal mortality risk as white women. 55 deaths per 100,000 for Black women. White women, 19. Hispanic mothers, 18. So not only do we have the worst maternal mortality rate in the developed world, we also have a maternal mortality that is flagrantly and blatantly racist. But it's only when social data becomes personal that its full impact can really be appreciated. So let me do that. According to the Johns Hopkins School of Medicine, most pregnancies progress without incident, but approximately 8% of all pregnancies involve complications that, if left untreated, may harm the mother or the baby. And while some complications relate to health problems that existed before pregnancy, others occur unexpectedly and are unavoidable. So what does a woman in a Republican-controlled state do if she's pregnant and develops complications that require, for instance, dilation and curettage, a D&C as they describe it in medicine? It's a procedure that's decades old, standard medical procedure to help diagnose and treat growths such as fibroids and polyps and endometriosis, hormonal imbalances, or uterine cancer. It involves the removal of tissue from the uterus. And we have a clear example. In Texas, the state Supreme Court has just confirmed laws passed by the non-medical legislators, again, politicians, not physicians, that say all preborn children have full human rights from the moment of fertilization. Therefore, a D&C pregnancy termination in Texas is abortion, not health care. And it could be considered, and some propose that it ought to be, a homicide, which would criminalize both physicians, nurses, and patients as murderers. Now, you're a practicing physician or you're a nurse in Texas or one of these states that has outlawed abortion. And a woman comes to you with a problem and you know what to do, but you can't do it because they might put you in prison or take away your license and destroy your livelihood and your family's ability to make a living. So basically, a woman in such a situation, faced with doctors and nurses who are in their situation and in fear, would just have two choices: leave Texas or die. And we've been hearing stories about this on the networks. Not surprisingly, such laws by non-medical politicians are having a profound effect on medical practice in states where the laws are passed. Louisiana, for instance, significantly falls below the already very poor national average on maternal mortality, particularly with Black women. Louisiana is basically almost a third world country. Black women represent 37% of the pregnancies, but 62% of the pregnancy-related deaths in that state. And this is according to the Louisiana Department of Health. In 2019, Louisiana health officials have reported that 4 Black mothers die for every white mother, and 2 Black babies die for every white baby. Part of the reason for this poor data is that the state's health care has been manipulated by non-medical politicians who don't even seem to comprehend. They haven't even done the homework to learn what they're ruling on. And it's resulted in a point where few physicians want to practice in the state. If you look at what's going on there, you see that OBGYNs are leaving these states, not just Louisiana, but these states with these absolute abortion bans. Hospitals are closing. Hospitals are not having, they're closing their OBGYN departments. OBGYN physicians are leaving. Non-medical politicians have taken control of women's bodies. That's the reality. Non-medical politicians. In May 2024, the Republican majority on the House Committee on Criminal Justice voted to eliminate the right of girls impregnated through rape or incest from getting abortions, claiming they were protecting the innocence of the fetuses. The baby in the womb is innocent. We have to hang on to that, GOP State Representative Dodie Harton, a woman herself, said. Look at the 14 states that have immediately after Dobbs passed these laws. No exception for rape or incest. Alabama, Arkansas, no exception for rape and incest. Idaho, no exception for rape and incest. Indiana, near total ban. Kentucky, near total ban. Louisiana, no exception for rape and incest. Mississippi, no exception for rape or incest. Missouri, exceptions for rape, but not for incest. So if your father rapes you, too bad. North Dakota, exception for rape or incest in the first 6 weeks. Most women don't even know they're pregnant in the first 6 weeks. Oklahoma, no exceptions for rape or incest. South Dakota, no exceptions for rape or incest. Tennessee, no exceptions for rape or incest. Texas, no exception for rape or incest. West Virginia, a near total ban to a point where it would require a legal decision in order for a woman to get treatment. Arizona, legal with a gestational limit of 6 to 18 weeks. There were more between 2022 and 2024. There were more than 64,000 pregnancies resulting from rape. Now that also tells you something about our society. 64,000 women and girls were raped and resulted in pregnancies. That's the current state of affairs after the Dobbs decision. But that isn't the end of what non-medical politicians have done in Louisiana. That same May, the Louisiana Republican governor, Jeff Landry, became the first governor in the United States to put his name to legislation criminalizing metopristol, metoprostol. Like the Dobbs decision, it was a stunning reversal. Misoprostol was approved by the FDA on 27 December 1988. Mifepristone was approved on 28 September 2000. These drugs have been considered by the medical community to be safe and effective, even in low and middle income countries, let alone in the United States, at up to 10 weeks of pregnancy, and are also used to treat a whole variety of other things, ulcers, and naturally occurring miscarriages at home. Not anymore in Louisiana. In Alabama, after studying what the non-medical politicians have done to that state, Georgetown University law professor Michelle Goodwin concluded, quote, "The perfect storm emerged. It started with prosecutions blessed by the state Supreme Court. Then in 2018, Alabama became the first state in the country to pass an amendment to its constitution recognizing fetal personhood. As I am speaking today, non-medical politicians in 20 US states are passing laws similar to what I've described, all predicated on some kind of non-medical religiosity or politically based understanding that a woman doesn't have the right to control her own body. And I could give you many examples of this, but you've probably heard these stories already on some media. And as I said, they're affecting even more than a woman's right to control her own body. The Dobbs decision and the post-Dobbs laws the Republican-controlled states have passed have changed and are continuing to change medical practice in those states in dramatic ways. A team of physicians led by lawyer-physician Professor Amarala Pashoff all affiliated with the Mayo Clinic, published a study predicting the medical impact shortly after the Supreme Court signed its judgment. And they said the Dobbs decision will directly affect patients and reproductive rights. It will also impact patients indirectly in many ways, one of which will be changes in the physician workforce through its impact on graduate medical education, current residency accreditation standards, training in all forms of contraception. In addition to training to provide abortion, state bans on abortion may diminish access to training, as approximately half of obstetrics and gynecology residency programs are in those Republican-controlled states. That's what they predicted. And that is exactly what happened. The bans are affecting the entire country. After Missouri banned abortion, the state saw a 25% drop in OB/GYN residency applicants. As the Missouri Independent reported, when they studied the effect, they found that all of the 14 states that had passed abortion bans saw a decrease in OB/GYN residency applications, even though overall throughout the entire country, there was an increase in physicians applying for OB/GYN residency programs. But they're applying in the blue states where women still have control over their own bodies. Missouri was second only to Arizona in the largest decrease in residency applicants. Kendall Origa and Atul Grover with the Research and Action Institute of the Association of the American Medical Colleges surveyed medical colleges in states with abortion bans and reported just last May, quote, a 2023 analysis by the AAMC Research and Action Institute found that fewer new graduates of U.S. medical schools applied to residency programs in states that banned or restricted access to abortion than the states where it was still legal. A new data analysis finds continued reductions in applicants. Now, when you look at that and you think about it also in terms of rural hospitals closing by the dozens and eliminating their OB/GYN departments, what's going to happen to the women in these red states? The Idaho Capital Sun in April 2024, just a few months ago, reported that board-certified specialists are leaving the state. Idaho has lost 55% of its high-risk obstetricians, according to their report by the Idaho Physician Wellbeing Action Collaborative. That has left Idaho with less than 5 specialists for these high-risk pregnancies. And as those doctors have left, family physicians and obstetricians across the state are asking if it's still safe, personally or professionally, to be providing obstetrical care. Now, to give you a sense of the impact of that, at the same time that that study was being published, the female population in Idaho was 961,894. So you got 961,894 women and you got 5 high stress, high emergency OBGYNs. What are those women going to do? Those are Americans. What are they going to do? What's happening is throughout the country, and particularly in these red states, and particularly in rural areas, is that general practitioners, GPs, are becoming very leery of taking on women who are or might become pregnant. And so what's happening are what are called medical deserts, areas where doctors are few and waiting times are long. And it's emerging all over the country, but again, particularly in states where politicians, not physicians, are setting the standards for practicing medicine. According to the March of Dimes, which has been studying and reporting on healthcare in the United States since 2018, quote, where you live matters. Maternity care deserts are counties where there's limited or no access to birthing hospitals, birth centers offering obstetrical care, or even obstetric providers. Areas with low or no access to maternal care affect 5.6 million women and have had an effect on 350,000 births across the United States. And that means that 1 in 12 women in the US are being affected by these non-medical politicians passing laws. What they are doing to healthcare is rippling out across the culture and society in ways no one considered. There was no prior discussion before these anti-abortion bills were passed in states after Dobbs was overthrown. You didn't hear anybody talking about, oh, what do you think this will happen to the doctors in our state? What do you think this will happen to the medical schools in our state? What will be the effect on the well-being of the women who are our constituents? The Gallup organization studied this and reported that 71% of currently enrolled and prospective college students say that states with reproductive health care policies that are restrictive are important in their enrollment decisions. So it's going to have an effect on colleges, not just whether you want to be a physician, but if you're a young woman and there's any chance that you're sexually active and you might get pregnant, do you want to be in a college town where there are no OBGYNs? Do you want to live in a state for 4 years while you're at college where if you develop some, forget about pregnant, just some kind of gynecological problem that you can't get treatment because some middle-aged white politician with no medical practice has made it impossible? 80% of all current or prospective students prefer states with greater access. 86% of Democrats and 63% of Republicans prefer states with greater access. So even the Republican kids who are in college get, you don't want to go to a college in a state where if you are a woman and you have some kind of problem, you can't get treatment. Look at the chart. In states that have enacted such laws, also This is yet another impact nobody was talking about. Corporations are finding it harder to recruit women in those restrictive states. As the New York Times reported, the political and legal landscape is radically different, and a Supreme Court decision that abolished the right to abortion is now threatening to reshape the lines of economic competition between conservative and liberal states. You're a woman, you're married, or you're a single woman. Do you want to go work in a state where if you had need of OBGYN medical care for whatever reason, you couldn't get it? Of course not. This is all part of the Great Schism trend that is breaking us into two countries in a single nation. Health care for women is being determined on the basis of religious and philosophical grounds with no consideration for good medical practices. And it's already clear that the effects are going to be much more complex than anybody expected or anticipated. We need to get clear that medical decisions must be decided on the basis of medicine, not politics or religion. Because if we don't, half the population in this country is at risk. And we got a vote coming up in November. If you're a woman, I think you better think very carefully. Only the Democrats are willing for women to control their own bodies. It is a staunch part of the Republican Party that politics, not medicine, should decide how a woman's body is treated. I'm not okay with that. How about you? Thank you.